Hi, my name is Bill Robertson, and I've been a patient here at Premier Medicine since January. Um, I had a minor heart attack and a stent put in in April of last year, and have had severe arthritis in my knees and hips for some time now. And I am not a good candidate for surgery, being on blood thinners and all that with the stent. And so we looked at options and heard about stem cells from a friend of ours at church who was very familiar with it in terms of backs and uh, various other places, but not knee surgery, except that his niece told him about a woman who had uh, stem cells used on her knees in Austin, and that led us to searching here in Houston, and had great success with it apparently. So anyway, our search led us to Premier Medicine, and I decided to get the injections, and we started that process on January 10th of this year. It's now late April, and prior to getting the injections, I was taking an opioid. I was taking tramadol probably twice a day, along with acetaminophen, which is all I really can take, and for pain relief. And the pain was debilitating. It would take your breath away lots of times. And I have not, now it's late April, I have had neither an acetaminophen nor tramadol since January 10th, since the time of the injections. And so my quality of life in terms of pain management has improved dramatically. And along with that, the physical therapy and the adjusting that the people here at Premier Medicine have done, I'm finding myself much more confident in my walking and stability. I'm much more flexible. I'm getting stronger all the time, and so I'm just thrilled. It's been an excellent choice. It was one that where my wife and I are both retired, so it was one that we had to look at very carefully from all kinds of conditions, including financially. But I would have to say it has been well worth the expense and the time and effort that has gone into my rehabilitation. And that I encourage anyone that's looking at this to look at it seriously.